Hi, this is Dr. Kimberley Linert, author of Visualizing Happiness in Every Area of Your Life and host of this podcast, Incredible Life Creator. And today I have with me Dr. Elizabeth Wisniewski. Hey, Dr. Elizabeth.
Hi, good morning.
Good morning. So excited to have you. And it is early morning there in California. So hopefully you're wide awake still.
Oh, yes, I am.
So, just so people know you, I'm going to go ahead and read your bio.
Mhm.
Dr. Elizabeth Wisniewski is a Webster perinatal certified chiropractor working at the intersection of clinical practice, social justice, and somatics. She's passionate about holistic perinatal education and care for all people. As a person with visual impairment who has experienced over 30 surgeries, she enjoys helping others turn their challenges into assets. Dr. Wisniewski practices in Ventura and Santa Barbara, California, as well as virtually. All right, Dr. Elizabeth. So I know you have a story to tell and you've been through challenges and are a huge overcomer. So I just love to hear your story.
Yeah, thank you so much for having me here. And it's just such an honor. And I'm excited to talk to somebody who also understands the physical eye and the inner, third eye intuitive part of sight as well. So this is like such a pleasure for me. And I want to start in my childhood. I grew up in Michigan. And when I was going in for routine exam before going into kindergarten with my pediatrician, they're doing their exam, look in my eyes with the ophthalmoscope, and just noticed my retinas looked slightly different and encouraged my parents to take me to an ophthalmologist. And when I went to the first ophthalmologist, they're like, we're not sure, let's do exploratory surgery. And my parents pushed back and they're like, we're not going to do that on our little child. So for about a year, we went to different doctors, and I ended up in the Detroit area going to a retinal specialist, getting diagnosed with pretty rare retinal disease that nobody else in my family has. And since then, I've had testing done. I don't have any genetic mutations. So it was curious why I was the one to have this, and I'll circle back to that later in my story. So growing up, I'd have surgeries, my retinas would detach, had a lot of laser surgeries for some internal bleeding, and had patches and did all these different things. But I was still a swimmer. I rode crew and was a really active child. But it was challenging going through those surgeries. And I got to a point for a while where I couldn't even go in for an examination. They had to put me under general anesthesia. And then if something needed to be done, they would just do it because I got so scared of the white coats and doctors. Because every time I went in, it was like, you have to have another surgery. So that was really challenging for me as a child and some trauma there. And I love now I'm in this profession that's free of surgery and prescription drugs as a chiropractor. So when I was 14, I was at swim practice, and all of a sudden I was going in for a flip turn and I never hit the wall. I just couldn't see the wall, and this black curtain dropped in one of my eyes and my retina had detached. So I had emergency surgery. 5 weeks later, my other retina detached, and I never regained the eyesight in my right eye after that. And because of all the trauma from the surgeries, it took a while for my eyes to open again. And during this time, I was experiencing this other major part of my life transform. It transformed me a lot because my mom was diagnosed with breast cancer for the third time, and she ended up passing away my freshman year of high school. So here I was, 14, had 3 big eye surgeries in a row. My mom passes away, then I have knee surgery 5 days after she dies, and it was really hard. High school was such a challenge, and that's already this hormone bath for anybody, but it was particularly really hard for me. I missed a lot of school, and I remember some of my teachers being like, you might not graduate on time, you're missing too much. even though I graduated with like a 3.9 GPA, and I did graduate on time, but that lit this inner fire of like, I remember being a teenager and saying, I don't have to prove them to them. Like, I just have to prove to myself, like, I can do this. So I went on to undergrad. I wanted to be an environmental attorney. And I double majored in environmental studies, political science, studying abroad several times throughout Latin America, and being really involved in different social justice organizations. And right after I graduated, went back to Michigan, having about my 30th surgery for a cornea transplant. And again, this didn't go well. I was supposed to gain more vision back in my left eye. And when I woke up in post-op, I just knew in my body, in my soul, in my soma, that something was wrong. And I lost really the remainder of my vision after that surgery. And it changed the trajectory of my entire life. So something my mom had helped me with as she was slowly dying my freshman year of high school, she had been a special education teacher and she was teaching me how to advocate for my needs in courses and to meet course objectives from a different perspective. So at that point, I was in geometry and we created pegboards with rubber bands so I could really feel the triangles and do things like the Pythagorean theorem through mental math and through the felt sense and using different parts of my body and my brain to understand what was going on in class. So this comes back then because here I am, I'm 21, 22 years old with a college degree. And now I'm like, I don't know if law school is right for me. And I'm back in Michigan and I hear this commercial for medical massage school. And it pinged for me in my body of like, this is what I'm going to do. This is going to lead me down this other path. At least I'll have this skill to go to grad school. I just wasn't sure if I was going to get like a master's or what I was going to do. But 2 weeks into medical massage school, I told my dad, thank you for paying for undergrad, but I'm going to go in this different direction. I think I'm meant to be a chiropractor. So I went and I took all these science classes, like chemistry and physics. Then I couldn't see the equations, but all these lessons my mom had taught me, how to advocate for myself and meet the course objectives, came back into play. So I was able to get through organic chemistry and physics and other science-based classes without seeing any of it and building models and doing mental math. And I was a very motivated 22-year-old. So that led me to chiropractic school. And after that, becoming a yoga teacher. And I had, again, this ping that I was meant to do more. And I ended up, while I was in practice, getting a second doctorate, a PhD in depth psychology and somatics. And somatics is the lived experience of the body, and my body going through 30 plus surgeries and the lived experience of losing my eyesight, but gaining a greater vision for myself and for the world was so strong. And so I tell my practice members every day, I can't see you physically, but I can feel you and your energy. And as a chiropractor, I use my hands and my heart and my third eye intuition. So it really is all constellated together because even like having an environmental studies background came back into play because I did all this environmental and social justice work. But now I do birth research and my dissertation was on the lived experience of cesarean birth from a cross-cultural perspective. And it hit me so hard while writing it of, wow, this is everything I did in undergrad. This is a different form of social justice. So I really, for me, the lesson is you can turn a challenge into an asset. Losing my eyesight never stopped me. I got 2 doctorate degrees and I would like to inspire people with that knowledge. So that's just a little summation of my life.
That's quite a lot. Quite a lot.
Yeah.
So, when you had so much trauma really early on, losing your mom, losing your sight,
Mhm.
the surgeries, what do you think began your healing process? What kind of things did you do, or who did you seek to help to start to heal some of those traumas from childhood?
Yeah, about a week after my mom died, I was started therapy, and it was talk therapy at the time. And she was a specialist in bereavement. And then I was in a group in high school for people who had lost parents. So that really started it. But moving away for undergrad was really healing for me, and leaving the state of Michigan, finding myself and my passions and all the nonprofit and environmental justice work, that was healing. Um, Really, what pushed me forward more than anything, when I was getting my PhD, we were required to be in therapy. And I was like, I've done all this different talk therapy. I want to go in deeper. So I found a practitioner who practiced EMDR. But because it's harder for me to do the eye motions, I held these little paddles that vibrated, back and forth as we processed different traumatic events in my life and all the surgeries and different things I've been through. And that was really powerful. And then getting adjusted to bring my nervous system into balance through chiropractic care and acupuncture. I get a lot of massages and practice yoga, and I meditate every day. I also chant kirtan, where you're chanting in Sanskrit, and play the harmonium and play a bunch of different instruments. And write music and poetry. So there's a lot of embodied practices and rituals that are built into my day that help me remember the deepest sense of that word, of bringing it back to my body and lived experience. And so people who meet me today, they're like, oh, you seem really at peace with this. And I'm like, this is a practice, just like everything else. I definitely have days where I wake up, like I was telling you before we started, I still dream in color, and then I wake up and I'm like, oh man, this is still my 3D reality. I can't see. But at least I have the dreams and that part of my psyche so active still. But it's all a practice, and I really believe in creating rituals. But if you don't do every one of them that day, give yourself some grace and ease as well, because tomorrow's a new day, and just be present in the moment. So it's through practice and rituals how I'm able to be here and be present.
So you started out wanting to go into law and social justice, but social justice is a very broad term. What specifically, where was your passion? Where was your heart when you went into social justice? What did you mean what do you mean by that?
Right. So at the time, when I was 19, got on the couple board of directors on nonprofits, and I was doing environmental and social justice work throughout Latin America and on the Blackfoot Reservation in Montana. So looking at that excessive burden on one group of people and creating equity and equality for all people and beings. So how it's transformed now is more into reproductive and birth justice, and looking at the disparities in healthcare, especially like the Black maternal health crisis in the United States. That's one of the things I'm most passionate about now. But it all connects and constellates together. So it's helping people have access, for me now, to holistic perinatal education and care. But then it was more about the environment. Like, I studied in Guatemala one summer, environmental justice and sustainable development. So working with women co-ops who were getting micro loans, because women put more money back into their families and communities typically. So that kind of thing.
Got it. So when you talk about social justice and, equal care, and you said specifically for the Black population, um, what did you see happening?
Mhm.
What did you observe? And what is your solution to help with that when it comes to prenatal care?
Right. Well, what's happening, and this is well documented in the research, is that in the United States right now, Black women are dying at 3 to 4 times the rate during childbirth as white women, but it staggers. Like in New York City, it's at 12 times the rate. So one of the biggest things I can do right now is educate other providers and then come up with trauma-informed solutions. And so bringing access, like I do pro bono work, I'm doing some of that today. And I next year have plans even to go to South Africa to lead some workshops on the benefits of vaginal versus cesarean birth delivery for the mom and the baby, and just looking at that dyad. So it's really addressing that root cause, because a lot of it is rooted in obstetric racism and violence within obstetrics, just in general, and in healthcare. So what can we do to dismantle that? Because some of that goes back to the founding of obstetrics and gynecology with Dr. Marion Sims, who invented things like the speculum. But he was practicing non-enslaved women without consent, 30 times procedure, just to like master these procedures that are now still used in gynecology. So I personally teach continuing education for the California Chiropractic Association on trauma-informed care. And one of the things that I'm really big into is consent. So what I tell my practice members, and something I teach, is I go, you're dynamic, and consent for me is ongoing. Consent can end at any time for any reason or for no reason at all. This is a safe and sacred environment for you that's trauma informed. So I make that very explicit with all of my new practice members, and that's what I teach as well to other chiropractors and doctors and practitioners, so that we can start having that consent conversation, because that's often lost or just kind of glossed over within healthcare in general. So I want people to always know all their options and opportunities and to give access. And my ultimate goal is to create my own nonprofit for perinatal, holistic perinatal education and care, so I can keep this message moving forward.
And why is cesarean not as safe? I mean, it's like a surgery. I know that. And I know a lot of people are pressured into it. I remember with my third child, my child was breech, which means she was upside down in the womb. So she was going to come out feet first. And my doctor kept pressuring me to have a cesarean. And finally, at the last minute, I told her, well, if you have to, you can do a cesarean, but if you don't have to, don't. And I remembered, because she was very angry at me because she kept scheduling cesareans and I kept canceling them. And and then when I actually did give birth, it was like she came in and she was actually screaming at me. So I'm in labor and the doctor comes in and she's screaming at me and so angry because I came in once I went into labor, and they're getting me prepped to do the cesarean, and all of a sudden I'm like, I feel something. And they look and there's a foot. And the doctor's really angry at this point because now she can't do the cesarean because the child is already emerging. And she did come out with lots of angels around her, beautifully, totally fine. But my doctor was very angry that I would not agree to the cesarean, that I wanted to have natural childbirth, that I didn't want my child to come out drugged. I never did any drugs with any of my kids. I didn't want them to come out drugged. I don't want their first experience of life to be like, I'm drugged. And no judgment on anybody else that has to have the drugs because it hurts. But I wanted everything to be natural, and I was lucky and thankful that everything turned out fine. But I mean, why is it that women are kind of pressured into having a cesarean instead of just letting things happen naturally?
Yeah. Well, first off, you're amazing. Doing a footling breach, that's awesome, unmedicated. Good work. And your body knew what to do when you trusted that wisdom. So I think that's beautiful, and I just want to acknowledge that. Part of what's happening is OBs are not trained in vaginal breech delivery. And we've really lost that art, and that's unfortunate. And in some places, they're not allowed to do it. And cesarean, being a surgical procedure, is easier for them because they can literally schedule it. So it's easier for their schedules. And unfortunately, they make more money from that as well. So there's that aspect. So in the United States right now, our cesarean rate is 31.9%, and it's not expected to drop for at least 1 to 2 decades. The World Health Organization says between 10 and 15% of C-sections are medically necessary, but anything above 15% does not reduce maternal or infant morbidity or mortality. And so just to put it into quick context, like South Africa private hospital system, 77% cesarean birth rate. Brazil's at 55%, Canada's at 26%. So we're sitting here, a third of our births in the United States right now are a C-section. And there are more risks with that because it is major abdominal surgery. There's a 20 times higher infection rate with cesarean birth compared to vaginal delivery. So that's a big thing to talk about that isn't often talked about. Then we talk about trauma to the tissues, going through those 7 layers of tissue to get to this baby. And I also have a lot of training in perinatal psychology and work. I adjust a lot of babies in my practice, and I'll do that when they're breastfeeding and talking to them about their birth experience and how they came into the world. And oftentimes, if they come out cesarean and it could have, especially if it was an emergency C-section and, there's all these drugs, mom's convulsing, super cold, this baby isn't able to complete their birth journey in that breast crawl. And that trauma can recapitulate throughout the lifetime unless that's addressed. And so, working with perinatal psychologists, you can have your baby keep practicing that breast crawl, even, they're a few months old, maybe they're a year old, but eventually working through that birth trauma. Because otherwise, I've had kids who are afraid to lay on my chiropractic table and look through the face cradle, and it turns out they were stuck in the birth canal. So these things do come up. And I heard a story the other night at a birth worker meeting where the mom, it was a breech situation, and they pushed the baby back up the birth canal and did a C-section. So what kind of trauma could come up? I know. It's like body's doing it. Fetal ejection reflex is real. And that baby into a childhood might feel like they're always pushed around, or however we want to look at that from like a depth psychology Jungian perspective. But that's really important to work through your birth trauma, and that's something I do in my practice too with the moms, having them dance, move, draw, write out, share their story. Because for millennia, women would sit in circle and share stories, and they would share their birthing experiences. And the research today supports that the more you tell your story, the more you're able to make meaning of it and not hold that trauma somatically in your body. You can get it up and out of your tissue into the collective where you can make meaning of that experience.
That is beautiful, and that makes so much sense. And I did want to add that when I was pregnant with that third child, I did everything to try and turn her around. I even put the ironing board up against the wall and laid on it, and my husband came into the room and said, "What are you doing?" I'm like, "I'm trying to turn the baby." But during that time, I had a chiropractor, and his name was Dr. Gladstone, and he had wanted to be a vet, and he had actually delivered many farm
Mhm.
farm animals, so
Yeah.
he knew what it felt like and everything. And so I remember him adjusting me. It was being adjusted every single day. I'd go in and he'd tell me, he said, from one day to the next, he said, "Oh, you have about a week." And then I went in the next day and he said, "You don't have a week. This baby is coming." So it had changed that fast. So he was that sensitive to the changes that he knew
Mhm.
from day one, where he thought, the first day he thought it was a week. And then the next day he's like, everything is moved. And she is like really low. She said,
Yeah.
"It's going to be in the next 24 hours." He was that sensitive. And I believe, since you are working with so many people in pregnancy, that you have that second sense or that feel.
Yeah. Absolutely. Well, and some of it is just the physical, palpating, feeling the tissue. You feel that sacred sacrum, the base of the spine move backwards, move posterior, and it creates a ridge, feeling the hips open. I can even feel in the postural muscles in the low back. if they're really like creating this ridge sticking out way past the spine, that the baby's probably OP, meaning they're sunny side up. And I'll text the midwives that I work with, and I'm like, oh, this baby seems sunny side up. We need to do some other things. And I'll be with people in labor and sometimes get to be at the birth with my practice members, which is awesome, and adjust them in between contractions. It's really beautiful to be in, I call it the Mother Earth energy, and enveloped in that.
There is a question I wanted to ask. So there are people that are afraid of chiropractic. Like they think if they go in to see a chiropractor, they're gonna, break their neck or break something or do something and cause them pain. And especially as a pregnant woman, we're thinking, well, we don't want to hurt the baby. So talk about chiropractic, the benefits of it, specifically the benefits when you're pregnant, because I know it made it my pregnancy. I went through all three of my pregnancies beautifully because of chiropractic.
I love when people come in. I think this is my Scorpio moon. I love when people come in and they're afraid of chiropractors or they've had a poor experience in the past, and I can rewrite that story for them and create a new pattern and experience. Most of my patients, they don't have pain during pregnancy when they're coming in. And I'm not a pain chaser as a practitioner, but that's just one thing. And the research does support that as well. And so reducing pain. But for me, it's about function. When I'm working with them, I'll be like, feel how, and I'll be standing behind them working on their sacrum and their pelvis. And I'm like, there's restriction here. By the end, your pelvis is going to move like an infinity symbol. You're going to be able to hula hoop or do a salsa dance. And they love that because they'll feel it at the end and that movement. So it's about getting everything balanced, like you were saying with getting the baby to turn. I do Webster technique, and that's all about balancing the sacrum. And what I tell people is like, your baby is an autonomous being with agency. So if we get everything balanced and it is right for them, they're going to be able to turn. I don't turn babies, that's obstetrics. I balance the pelvis. But it is really safe. I have pregnancy pillows, and I'm like, you get to embrace your inner turtle and lay face down, put your belly full. But I bring in the perinatal psychology stuff too, where I'm like, let your baby know we're gonna lay down. There might be a little pressure, but they're safe. So I encourage them to keep talking to their baby, and I really keep talking to my practice members during, and I'm like, I'm gonna do this and get consent along the way, so they do feel safe and honored, and letting them know their baby is safe. Um, and especially, when there's a lot of relaxin, we're not going to do anything really aggressive with a lot of rotation. And in California, we have pretty strict verbal and written informed consent laws. And so I go over all of that with them so that they know the risks and they know the benefits. And the benefits definitely outweigh the risks, where the number one side effect of chiropractic is some soreness, kind of like a deep tissue massage. So once they know that, they usually feel safe. I'm a pretty old school chiropractor, hands on. I don't have a bunch of fancy tools. I have a very basic adjusting table. It's just flat. There's nothing happening that's hydraulic. So it's old school because I like to use my hands and really feel everything. But I give them a lot of homework and empowerment, but I bring in meditation for them and movement and somatics. So it's a different experience. It's beyond chiropractic. I do longer sessions with them than most chiropractors because I don't want people just to crack their spine and send them out. I'm like, I want to empower you and partner with you on your health journey. So chiropractic is really safe during pregnancy. And then I also see lots of babies, and we're not cracking their spines. I'm touching the vertebrae and holding it and talking to them about their birth experience. And the pressures, like you're touching your own eyelid or testing a tomato if it's ripe. It's really gentle.
Exactly. Yeah. I remember when after my kids were born, I brought them all in within a day or two. I mean, I feel like that's the first thing. They just went through trauma. They, they need to be putting everything adjusted, and it's almost like it's just touching, just like
Yeah.
hardly anything at all.
It's so gentle yet so powerful, especially getting those upper cervicals and the upper part of the neck and their occiput at the base of the skull there. I mean, that is when the life force comes in and it's so potent. I love doing that. My patients are like, how soon? I'm like, as soon as you're ready. I'd be next day. And, in case of if the baby is in this optimal position of being head down, facing toward the mom's spine, left occiput anterior. I'm always like, it's LOA, and you can remember it by law of attraction. That's a good position. But then I'm like, so think about this. Everything your vagina goes through, your baby's head goes through the opposite direction. And there are forces there that are similar to being in a car accident. That's how much force there is. Those cranial bones are compressing and molding. And so bring them in because that's a lot and it's a dance. You're a dyad. So come on in with the baby.
Beautiful. So you said somatic a few times, and you said a little bit of description of it, but you did a whole degree on that. So describe a little bit more what you mean by somatics.
Somatics is about the lived experience of the body. And so you can have the body and then you have the soma. And let's say you die, your body's still there here on earth, your soma is not. And so your soma is more, it's the first person experience of the body, but it has that spirit, that soul aspect to it as well. So a couple of ways of being embodied and like with your soma would be, for example, interoceptive awareness, noticing what's happening within your body of, oh, my breath is slowing down, my heart rate is slowing down, I'm noticing a little pain in my big toe. That's your inner awareness. Then there's exteroceptive awareness. I'm hearing this bird chirping, and you're just noticing it. And then the last big aspect of it would be proprioceptive awareness of where your body is in time and space. So those are some big components within somatics. So somatics is a big growing field right now and encompasses so many things from yoga to mindfulness, meditation, and different movements, authentic movement like dance. Um, it's a growing area for sure within scholarship right now. And just, I mean, I'm on Instagram, I see it everywhere, and I'm like, what does this mean to this person? So I'm glad you asked from like an academic standpoint. It's the lived experience of the body from a first person perspective.
Got it. So if you just wanted to give one message to women who are pregnant and about to go through this beautiful transformation of being a mom, what would it be? What would you tell them?
You know your body better than any doctor ever can or will. Trust your inherent wisdom, that intuition, the deep seat of knowing that you do know what's best for yourself and for your baby, and to stand firm and advocate for that, creating a birth vision versus a birth plan that is expansive, has boundaries, and also some flexibility. So, it comes back to vision, the birth vision, your inner knowing.
Got it. And, of course, women who live in California near you, they could come and see you. But let's say someone lives in Georgia where I live or Michigan. I actually grew up in Michigan also. So what if they live somewhere else? I hadn't even heard of chiropractors specializing in this perinatal area. How would they find a chiropractor who is specifically trained in that?
The International Chiropractic Pediatric Association, ICPA, you can search by zip code. So you're going to find people who are Webster certified, which is our prenatal technique, or Webster plus perinatal, like I am, which is about a year extra training in perinatal. But then there's also people who have diplomates in pediatrics on there. So ICPA is the best way to find a chiropractor who has advanced training in pregnancy and pediatrics. And for me, yeah, I'm in Ventura, just north of LA. I'm have some new options coming out soon. I'm rebranding, a new website's about to be launched here in the next few weeks. So there'll be virtual options where we can talk through your your birth experience and story and process that and do some somatic movements and meditations. So you can work with me from anywhere through that capacity. I'm a somatic movement therapist, and so we'll bring those aspects in. And it's different for everybody. I've had people draw with crayons out their birth story, or we might do a movement or a song. So it really is individualized care.
All right, that is awesome. And I did want to talk about that vision. Most of us are sighted, but
Mhm.
there's people like you have lost your sight or they come into the world without sight. So, um, this is kind of a multi-parted question. Um, Explain your experience and how you experience that inner vision and just how that shows up in your life. And then the other part of the question is if someone is in that situation where they're losing their vision, like there's eye diseases like retinitis pigmentosa, where they know one day they're not going to see, or a lot of people with diabetes that's
Mhm.
really out of control. They know one day they may not see. So, what would you tell them? So, you see, it's kind of a lot of questions, but just that subject in general.
Yeah, absolutely. So, first part, how I experience it, I started noticing early in practice, I'd be working on somebody's neck, but in the field around them, I would see like an energy, kind of like a little flare of light within my third eye. Even if my eyes are closed, I would experience it. And I'd be like, oh, I need to check their right ankle. And I would go and adjust their talus, their ankle bone, and go back to their neck, and their neck was more flexible. And I'm like, wow, what's going on here? And so I started really following that wisdom I was experiencing that I think it can be lost in healthcare. So for me as a practitioner, the evidence-based triad is the research, the patient preference, but that clinical expertise. And part of clinical expertise for me as a doctor is intuition and following that. So I notice like shoots of light and little like flares, little explosions of color. So when I got my second Siberian Husky, the one I have now, Jaya, at the animal shelter, I have this on video where I stick my hand in this kennel, and that's not a normal practice of mine to just stick my hand in the kennel of a new dog. But our third eyes connected, and it was this blue and yellow explosion, which is the same thing I had when I got my senior husky when I adopted her. And I was just like, this is soul family. And so on the video, I start crying, and I was like, I love him.
Oh.
And he's been with me for the last 5.5 years. It's a really amazing dog. And so I feel that, and I call it third eye blinging.
Mhm.
And he's like, my dad's like, he blinged me. And so it's like, it's just like this explosion of light and colors, but then I feel it kind of cascade and pour over my body and around me in my auric field too of like yes, and that's the feeling I get come through me. I just felt it now like cascading and didn't know where I was going with it, and but it's like this from my heart, like it's a big yes from my heart and my soul, and I feel it. So it's tapping into that would be starting a meditation practice, I would say, or writing down your dreams or making a little voice recording of it. So you start becoming aware of these little subtle energies of remembering one little aspect from your dream or mindfulness of, oh, I felt this when I dropped in. Like I had energy healing session yesterday and she's like, where did you go? And I was like, I was in a psychedelic other plane. Yeah. And what's cool is this person has a doctorate in nursing. She's very Western, but then she practices like spinal energetics. And so it was really great. She's like, I felt your body drop. I'm like, yeah, I don't know. I was somewhere else.
Mhm.
So it's trusting that and letting the surrender. It's kind of like birth. You got to just surrender. And the practices are different for everybody. So I'm really into meditation. I create my own meditations and get them edited and with music put in, and then I listen back over and over again. And so, and I just channel that. That's how I write music too. So it's dropping in however that looks for you. But also, like what I said with birth, you got to trust your body and go with it because it's scary to go into that. And when I first started deeply meditating, I was actually really afraid because it reminded me of going under general anesthesia, where I'd always have this sense when they're counting down, like kind of, I'd be falling from like the front of my head almost to the back, like
Mhm.
within my mind. And then also I was out, and I was afraid of that in meditation until I finally just deeply surrendered to it.
Oh, that makes sense. I've had that experience. And then, you know, people who they're in that situation where very likely they're going to have that loss of vision. What would be advice, word, anything you would say?
You need, I would say, to get some therapy and probably EMDR kind of therapy where you're processing some of that trauma and creating a new story and neurological pattern. It's neurons that fire together, wire together. So start working with that. Um, that really has helped me quite a bit to find meaning in it. I worked with a shaman for a while of trying to understand why my soul took this contract to lose my eyesight. It took me back to being in my mom's womb of like making this pact to lose my eyesight. And once I had that experience of just knowing, like, I chose this, my soul chose this, it shifted my relationship to this quote unquote disease of like, no, this was meant to be. And I wouldn't be a chiropractor or have a PhD if this hadn't happened. So be open to different practitioners and experiences beyond what like the Western medicine offers.
And then this might be kind of a different question, but I noticed when looking at your website and you describing your life and your dog, and you use words so beautifully to create pictures, and you use words always that have a deep meaning for you. Like you'll describe, I named my dog this because talk about how you use words and how what those what is the what is important about that? What is important about how you have to have a meaning behind things? Do you understand the question?
Yeah. I feel like that's my Scorpio moon. I like to go in deep. I always want to know the root of things and words. Like you're mentioning, my dog is Jaya, which is victory in Sanskrit. And my dog before that was Durga. So Jaya Durga in Sanskrit's a victory to the mother. And that felt potent for me for losing my mom. But then also I work with mothers all day. So I always want those deeper meanings. That's important for me. Because words and the spellings, that spells, and you're putting that out in the universe. And so I think it's important to choose our words carefully and mindfully. So because they're potent messages we're conveying. And it's like self-talk as well, where you need to like big up yourself. You have to like I pump up everything too. Like I'm always, if you watch my behind the scenes on my Instagram story today, you'll see me getting ready for this interview and I'm like laughing. I haven't had any coffee yet. And I'm like, gotta pump up. So I use words as medicine. And when I write music, I call it my oceanic crevasse. I drop into this channel and it flows through me. I'm just a vessel for those words to flow through. And I feel that same way in meditation when I create those. So I think they're medicine, and that's the kind of medicine I want to take every day. And so I think it's important.
Thank you for that. So, if people want to connect with you, if you can just, you went over it a little bit earlier, but what services do you have now? How do they connect with you?
Right now, it's in person, perinatal and pediatric chiropractic. In the next month or so, there'll be more virtual offerings. but right now everything's changing. So the best way to connect with me, so we stay connected because I'm gonna have a new website domain soon, is through my Instagram, Dr. Elizabeth Wisniewski. And there you'll see in my bio my link tree, and you can see all the projects I'm working on. I'm building a femtech company for a menstrual empowerment tool and different projects I'm working on right now. So Instagram is really the best way to connect with me to stay apprised of new offerings.
All right, thank you. So now I have a personal question for you. What gives you the most happiness and fulfillment in your life at this point?
Oh man, I love that question. Definitely Jaya. And then I would say my partner. He's really supportive of me and he's an amazing musician, artist, songwriter. So I feel really fortunate to have him in my life and my dog. And that brings me a lot of joy, just like the future we are co creating.
Right, thank you. And thank you for being on the podcast today and for all your wisdom.
Thank you so much for having me.
Yes, so I have one last question before we finish. What is your best advice on living an incredible, amazing life?
Trust your body's intuition. And when you have that embodied yes, follow the yes. Don't ignore it and push it down. Follow it. Be like, yes, I feel that. I honor it. I acknowledge it. I'm going to move forward and do that.
Beautiful. Thank you so much, Dr. Elizabeth.
Thank you.
We'll talk to you again soon.